Huddle Up Moms was recently awarded a grant from the CDC's Hear Her campaign, which raises awareness about urgent maternal health warning signs. We are joined today by Dr. Jacqueline Nunziato to discuss the new Be Vocal Postpartum Still at Risk program this grant helped create. Welcome to the show. Great to have you.
Yeah, thank you so much for having us.
Yeah, so tell us a little bit about the Hear Her campaign and this the grant that you were awarded.
Yeah, so we're excited. The Hear Her campaign is all about elevating the fact that women that are pregnant and postpartum, even though you have a baby, you have this wonderful experience, that first 6 weeks and then a year up to delivering, you are still at risk for some major complications. And what we've seen over the years when we look at all the data is that there's not enough awareness, there's not enough understanding, both on the public side and in the healthcare space in the community, of what these risk factors look like. And so we're excited. We came up with, I think, a wonderful proposal, a way to kind of represent moms. We have this vision of all pregnant individuals in the state of Virginia on discharge getting a bracelet that tells the rest of the community, hey, it's not just about the baby, it's not just about labor and delivery, I'm still at risk. And so we want everybody in the community to know what the warning signs are.
Yeah, absolutely. And it's a teal bracelet just like that.
Yep.
And it's all about Hear Her. So I was surprised when I kind of dove into this, preparing for this interview, how many symptoms and, health risks that women face, not only during pregnancy, which I think that most of us know, but really, like you said, a year out. And some of these women experience these, symptoms, kind of talk to their doctor, and then maybe are brushed off or are just told, oh, it's normal, it's nothing to worry about. So talk to me a little bit about some of these symptoms that are really alarming.
Yeah, one of the things I think we pride ourselves on Huddle Up Moms is trying to find the gaps, right? And one of the gaps that we've seen is women just don't know that they're at risk. And so things like chest pain, shortness of breath, seizure-like activity. We know we've talked before about depression and anxiety, thoughts of harming yourself. Those are all really critical warning signs, and I think can easily be brushed off if women don't understand or know. What we do know statistically is that they are showing up, in the emergency rooms at small hospital centers, maybe back, weeks and weeks and weeks later. And one of the questions I think people don't ask them is, have you delivered recently?
Wow.
It kind of is this finite amount of time, and then you move on and you take care of the baby. But if you don't know what to look for, and so this is an education program, but it's also an awareness piece. I think we want, partners, mother-in-laws, people in the community to say, hey, did you recently deliver? I see you're wearing a teal bracelet, because I think it's easy for moms to put themselves on the back burner immediately once the baby comes. And so we want to make sure that we're giving them not only the signs and symptoms to look out for, things like fever, pain in the legs, swelling. Those could be all signs, for example, for things like blood clots. We know even infection rates can still be there, weeks after the delivery. And so we want moms to understand that they're still at risk, but also to feel empowered. Sometimes even just something like a visual representation. We love our bracelets. The bracelets say VA Mom Strong, postpartum still at risk. And then when you flip them over, the whole point is that you flip them over after a year and they turn pink. It's kind of this like, get your pink back.
Oh, that's so cute. I love that. Okay.
Yeah, and so it's kind of like, a baby celebration 1 year, but you also are out of the window and you've made it, and you've put in yourself first and your health first. And so we're excited. Starting over the next couple of weeks, you're going to see flyers, billboards, kind of signs and media and marketing everywhere. And we're hoping to start here and move across the state. It's exciting.
Yeah, it is exciting. And I think that that's, just the awareness piece, letting women know what to look out for, and also advocating for themselves.
Absolutely.
Sometimes if they suspect something, that this feels a little weird, this doesn't seem normal for me, to go to the doctor and really advocate and just say, hey, something's not right.
Yeah, and I think, with our wraparound services and so many moms now enrolled in our blood pressure program, and now with our diaper bank and in a lot of our support groups, we're able to kind of tell moms like, hey, what you're feeling may not be normal. You really need to speak to somebody about it. And, we're also giving them the words to use and showing them videos and how to talk to your provider, how to talk to your partner. We always say it takes a village, and we want people to feel equipped and able to understand their own health, right? And so when we first started, like, what can we do? It's part of a whole movement, I think, to be seen and to feel heard and be vocal. And so we were excited to get picked and chosen by the CDC and really honored at the experience.
Yeah, I know that was a lot of hard work. Congratulations.
Thank you.
I know.
Yeah,
and thank you for all the work that you do for our moms and, helping them feel validated too with what they're feeling. Is there a certain website, huddleupmoms.org, of course? And
yes.
I'm sure we'll see in the coming months all of the Hear Her campaign materials, billboards, stuff like that, right?
Yeah, we're excited. We have just some like little teasers, but when you go to our website, you can, still enrolling in the blood pressure program, and then there'll be a whole page and website dedicated to all of the resources, going back to the CDC, going back to local resources. You can sign yourself up and get a postpartum bracelet as well. We have videos launching that we've made. We've made a lot of educational material, really just to kind of help supplement and really get people feeling empowered and seen and heard. So we're excited. Yeah, October 1st.
Okay, October 1st. So look for all that information. Thank you so much for coming on and telling us all about it and for all the work that you're doing.